Yeah, so I'm really excited to see this study get presented. So Cevostamab is an FcRH5 CD3 bispecific T-cell engager. The study was a first-in-human dose escalation study for patients with refractory multiple myeloma. There were multiple cohorts evaluated, multiple step-up doses and target doses, and overall over 300 patients were actually enrolled on this study. The target dose of 160 milligrams was achieved, or 167 patients actually received that dose through a variety, and achieved that dose through a variety of step-up schedules, including 2 step-up doses as well as 3 step-up doses. The recommended phase 2 from this dose will be the 3 step-up dose regimen with 160 milligrams administered. So the data actually presented here in this abstract is the safety as well as preliminary efficacy data from this cohort of patients. So, of course, the main adverse effect of that these patients experienced was CRS, or cytokine release syndrome, which was experienced in approximately 50% of patients, with the majority of these events being grade 1. Infections were also observed, but the majority of them were non-serious infections. Serious infections, as well as some fatal infections, were actually observed on the protocol as well. The patient population overall, though, was heavily pretreated, with the total group of patients having received 6 prior lines of therapy. The majority were penta-drug refractory, and over half had received prior BCMA-directed treatments. And so in this heavily pretreated patient population, having this novel therapy was quite is an advance for the field. So the response rates overall were for the 167 patients were approximately 44%, with a quarter of these patients achieving VGPR or better. However, in individuals that had not received prior BCMA-directed therapy, the response rate was 60%, whereas those that received prior BCMA-directed therapy, the response was lower in the low 30%. Duration of response for those that achieved a VGPR or better was over 21 months or so. So I think this, this study represents sort of a novel target, a CD3 T-cell engaging therapy that's not directed at BCMA, not directed at GPRC5D. So it's another option for our patients, and it is active and leads to durable remission. One thing I should also add is this study was designed for a fixed duration of treatment, where individuals received 17 cycles of treatment every 3, with a treatment once achieved to the target dose every 3 weeks. This was approximately 1 year of therapy, and among individuals that completed all the therapy, responses were quite durable off treatment, especially among individuals who achieved a complete remission, with the majority of those maintaining response for more than 6 months.